Welcome to the Peoria Riverfront Museum. My name is Renee Kerrigan. I'm the Vice President of Programs here at the museum and science enthusiast. And I'm so glad to have you all here today. And I am grateful to Dr. Pearl and Jump for bringing us this fantastic program. Today we're going to learn from the best of the best about tissue engineering. So I hope you enjoy the program and learn a lot. I'd like to thank the museum members and Visionary Society members who make programs like this possible. It's our goal to inspire, and without their support, we wouldn't be able to do the work we do. And I'd like to introduce our President and CEO, John Morris.
Thank you, Renee. Welcome, everyone. Today, for the Peoria Riverfront Museum to host Dr. Rick Pearl in this panel is a great honor for us. You are about to hear from some of the greatest scientific minds that we could have possibly assembled. And Dr. Rick Pearl, who's a great friend to this museum, and really the founder, co-founder of the Jump. How many of you have heard of the Jump Trading Simulation Center here in Peoria? Almost all of you. Great. And how many of you have been to the Peoria Riverfront Museum before today? Almost all of you. You're on your way. If you got those two things, your path is clear to success, right? Jump trading and the Peoria Riverfront Museum. It is very exciting for us to have organized the 10 medical inventions that changed the world. Our first ever exhibition, taking the objects of medical breakthroughs and bringing it to the public. And how many of you, one more question, have been through the exhibition? Were you able to get through the exhibition earlier today? So in there, you would have seen, as one of the many exhibitions or exhibits in that gallery, you would have seen an exhibition on tissue engineering. You would have seen an exhibition on 3D printing of organs from Jump Trading. You would have seen the dynamic interface, video interface made possible by Jump Trading. So Jump Trading Simulation, a facility at OSF. So here in our community, through a multidisciplinary approach, we're working to inspire you. And we're happy to have you in today. Come back, keep learning, keep the love of science and learning going, because from Peoria and the Peoria area, you can go anywhere in the world. So to introduce our very special guests today is a friend of this museum, a member of our Visionary Society, co-founder of the Jump Trading Simulation Facility at OSF, and in his own right, in my opinion, and you close your ears on this, one of the most brilliant, dynamic thinkers that we have in our whole region, Dr. Rick Pearl. Ladies and gentlemen, he will introduce the panel, but help me welcome Dr. Rick Pearl to the Peoria Riverfront Museum.
Thank you. You all can read Dr. Vacanti's bio there, so I won't belabor it. I will tell you that I'm a pediatric surgeon, and so is Dr. Vacanti, and that's the basics of our DNA. I met Dr. Vacanti in 1983 when I was in a research lab, and he used to drop by and see what we were doing, because we were doing research on liver transplantation. He was about to start his liver transplantation program at Boston Children's Hospital. He is one of the surgeons that is the father of pediatric liver transplantation, which I think is probably the thing he may be most proud of all the things he's done. And I scrubbed with him on the very first pediatric liver transplant he ever did, and that's where we got our start together. We've been friends ever since. And I'm so happy he's here today to talk about tissue engineering. Next to him is Dr. Casavadas, who's the engineer in chief, both at Jump and the connective tissue between Jump and the University of Illinois College of Engineering. And we have multiple research projects between Jump and U of I, and it's been a very exciting collaboration. And next to him is Joe, are you next to him? Yep. Yeah, is Dr. Joseph Piccioni, who is both a lawyer and an ethicist, and as he told me, it keeps him conflicted all the time to have those two things trying to tell him what to do. It's kind of a comic joke. I don't know if you get that at your age. And he's here to pitch in on the ethics of this very exciting field. And then on the far left is Mr. Guha, who is the president of CGN Global, which is a consulting firm, and he's going to kind of help us figure out how the commercialization of this might work out in the future. So that's the panel. Welcome all. So, tissue engineering. So I will, if I could, I'm somewhat, so that's the picture of Dr. Vacancy's ear mouse, which he will chat about, I think, at some point. That's a tissue engineered ear attached to a mouse. So I'll turn this over to you now today.
Okay. Hi. I'm going to get up so I can actually see the slides. But first of all, it's a great honor and pleasure for me to be here. And I'm particularly enthusiastic about you all being here. So to say something before I actually talk about tissue engineering, say two things. This year, as Renee pointed out earlier, is the 50th anniversary of men landing on the moon. July 20th, 1969, 50 years ago. So why is that important? At that time, I was roughly your age, and so I followed the entire program from the beginning all the way through the landings like they were sports heroes. And so it was very, very inspiring to me to watch all of that evolve. So I think as a young person, you can get excited about a lot of things, but I think getting excited about some remarkable achievements and then deciding that you too would like to be like those people, I think is really, really important. Second thing is, as you see from all the badges and such, I'm from Harvard, right? Harvard, Boston. I actually grew up in Omaha, and I was educated totally through medical school in Omaha, Nebraska. So Omaha is really not much different than where we are now. And so I'd say the major limitation for any of you is what you put on yourself, not where you are from. So be inspired and decide what you want to do. And maybe some of you might be interested in what we're going to talk about.
If I could interrupt, actually, at least 5 times as we drove through Peoria yesterday and today, Jay said to me, I can't believe how much Peoria looks like Omaha. Yeah.
Rick, will you actually do the slides? Okay, so these slides are really simple. They're not intended to make much information. So human bodies are living machines. And everything that happens with what we talk about today and in the field of tissue engineering and regenerative medicine could not be done if conceptually we didn't understand that human bodies were living machines. Now, humans always didn't think that. And in point of fact, in Western civilization, which we're part of, it was forbidden to think of the human body as a machine. And the first person to actually delve into it in a scientific way was Leonardo da Vinci. So that's why I put that first slide up. But conceptually, you have to have the right frame of mind in order to make the next steps. Backwards.
I'm electronically challenged, sorry.
Okay, next slide. All multicellular organisms are cells on a scaffold, period. It's the case. Now, is it that simple? Not that simple. It turns out to be fairly complex. But at the end of the day, if what you're trying to do is build a living structure, those are the central components of what you need. And then it boils down to the details. The type of cells, stem cells, not stem cells, the type of scaffold, natural, full, molecules, synthetic, man-made, degradable, permanent. Those are all the details. But you have to start with cells and scaffolding if you're going to make a complex living tissue. And tissue engineering was created because of a need for humans. It wasn't created because it was interesting. It wasn't created because we were scientists that just wanted to discover secrets of nature, which is a great thing to do. But for our purpose, which was trying to make sick people better, we had a purpose beyond pure discovery. So back up. Tissue engineering was created to replace damaged tissues and organs with manufactured cells on scaffolds, okay? And the analogy is, let's say there are 1 billion people on the planet that could use this technology. There might even be more than 1 billion, but let's say 1 billion people. It has to be scalable. And anything that we do that's scalable is manufacturable. So all the engineering that we do has as an end goal, manufacture it. Like a cell phone. You know, Apple's iPhone, created by the millions, maybe even billions. But it's manufactured. So the trick here is we're manufacturing components like a cell phone, but we also need to scale up the right kind of cells. So as much as we can, those cells need to be in a manufacturing environment. And think about the vats that when you refine fossil fuels, those big polluting things into the atmosphere. Well, those are designed by chemical engineers, and you can make something like that, only grow cells in those things. So everything we want to be scalable so that we can give it to whoever needs it, and the costs go down as you do it more and more and more. So that's my introduction.
Okay. So, that's our panel. I've introduced them. Mr. Guhad, Dr. Scasivadis, Joe Piccioni, and Dr. McCanty. So our first question, what was your aha moment that got your research in tissue engineering started? How is it related to angiogenesis and your work with Dr. Folkman? Dr. Folkman was Dr. McCanty's mentor, and he worked in Dr. Folkman's lab when he first got started, to give you some background.
So the question of an aha moment, I guess first there was this massive need that we couldn't fill. And I would have patients, little babies, who needed an organ, in my case livers. And so those are what are called vital organs, meaning that if they don't work, you die. It's not equivocal. So if you have a disease in one of your vital organs and the disease progresses, then the patient gets sicker and sicker and sicker. So the people before me had invented transplantation. And so when an organ became so diseased, a major improvement in patient care during the 20th century is if you've got a damaged heart or liver or kidney or lung, surgeons could take that one out, and from a donor, you could take an organ that was still in good shape and put it into the recipient and then give them drugs called immunosuppressants because it wasn't a perfect match. The problem became that it was successful and there were so many people that needed it, organs didn't come available. So in my own experience, I would have these little babies who had these liver diseases, and we had assembled the team, we had practiced transplantation, we knew how to do it, the intensive care doctors knew how to do it, but we had to wait for an organ to become available. We'd wait and wait and wait. The patients become sicker and sicker and sicker, which made our job more difficult, and then many of them would just die before you got an organ. So that was a very personal experience for me because your hands were tied. It was awful, and it was awful for the parents. So I had this emotional need to somehow solve the problem.
Yeah. When do you see engineered organs becoming clinically available, and which ones?
Is this all to me?
Yes, to you. Yeah. No, I'm going to get to them. I'm going to get to them.
Okay. So when do I see organs coming? So you all may know, and from the exhibit, you may know that there are many structures that started as tissue engineering projects that are now in humans. but they're pretty simple structures compared to a whole organ. So what I'd say is there are stages, and we're sort of in the second stage. So the really simple things like skin, you can get tissue engineered skin of more than one type that's available for hospitals around the world. The second step is also in the exhibit, which is maybe you could take a thin structure and roll it into a tube. There are a lot of tubes that humans need. There are blood vessel tubes, there are the tubes that are the esophagus, or the airway tube, the trachea, and the small bowel that absorbs all your nutrients. That's a tube. It's a very long, sort of like a garden hose. Anyway, those sorts of second stage things are now in late phases of research and have started clinical trials. The third phase is the whole organs, just to answer Dr. Pearl's question. And I would say that we now know enough and have enough technology that it's resource constrained, meaning the more people that are working on it, the more money that's thrown into it, the more quickly it's going to happen. But we've got all of the principles and the technologies that we think can get us into humans.
Cash, one of those tubes is not simple. The small bowel is complicated because it has an absorptive surface. Do you have any engineers that are working on that? Are you aware of that?
Okay. So let me start by saying that I'm not a doctor, but where we come in is trying to engineer the process. So in my opinion, tissue engineering is what manufacturing was about 150 years back. So if you've gone through a history book, you know that when the Industrial Revolution happened and steam engine started creating energy and they wanted to improve manufacturing, and that's when they started looking at how you can produce better products. And then when the car industry came, they started thinking of making replaceable products, right? So you can switch parts between cars, and they standardized products. So you can go to any store and buy a product, right? So you can think of tissue engineering now like it is in 1850s. So what Dr. Vacanti and his teams have shown is that with the right science and right manufacturing, you can make products that is human body parts that can actually be used clinically. 50 years back, science fiction writers did that, and I'm sure there are Hollywood movies where you've seen human beings being put inside, hanging from thread just to create parts. That was, what Hollywood is doing. But now we have reached a stage where I'm sure every one of you know about 3D printing. We can print bioprinters. And in the earlier talk today this morning, Dr. Vacanti was mentioning about all of the exciting methods that you build these 3D printed parts. So from the engineering perspective, what we are looking at is how do you take these lab ideas and really make something that can be produced in mass, but then no two human beings are the same. Unlike the same models of car, people are all different, so there has to be customization as well. So we are far off from just printing vessels that will automatically fit for every human being. We have to print something which fits for what we call as a patient-specific needs, and from adult to pediatrics to people with different structures, the needs are different as well. So there are lots of people in the country, and there are some groups in our campus also who's working on those things. And I can specifically mention one of the groups that we are funding. They're trying to build very natural-looking heart using type of polymers and things like that. They're very realistic, but they're not being printed right now for clinical applications, but they're being printed for doctors who want to be a cardiac surgeon to practice on how do you cut open a small heart and go inside and fix it. Instead of practicing on a real pediatric heart, you can practice on these hearts. You can suture them and get the similar effect like stitching on a real tissue. So these kinds of 3D printed parts, which are very similar to the tissue, has a very broad application, and not just in clinical, but for training and things like that. But it actually is leading towards printing that will eventually have the blood circulation inside and all of the requirements for an organ to be a real organ. And like you were talking earlier this morning, that when you put a plastic thing in a small child, as a child grows, the plastic doesn't grow. And that's a small things that makes synthetic things does not work well on human beings. But the challenge is how can you take now living tissues as opposed to plastics or polymers so that they also grow as a child grows and becomes big. So there's a lot of work going on campus, and one of the things I mentioned is 3D printing, but we also have a colleague who I worked with, Dr. Vakandi, many years back in Dripper Lab. He works in micro etching, micro fabrication. They're looking at making capillaries, small vessels, so the blood flows in organs like liver. So it's very exciting.
Thank you. Okay. I think we'll skip this one. Right. Mr. Guha, what are the commercial implications for production? Yeah. If they come up with something that is doable, how would you scale it up for production?
Yeah. Before I get to that question, I want to kind of give a little touch base. So I grew up as an engineer in manufacturing, interestingly enough, and my first job was in a bus company, and I was responsible for making the gears that go into a bus, right on, actually in the engine which went into the bus. So it's amazing that, you know, as we talk about tissues and they need to do this, that little gear, if I stopped that, it didn't work right, the whole bus was not going to work right. So it was a high pressure job. Then I got pushed to basically be the guy who basically ran the engine. I had to make the engine. I was running the whole engine line. Then later I got to run the bus line. But it's interesting from a manufacturing and production standpoint, and I'm thinking about this more from all of you whose whole lives are in front of you. Fundamentally, there are three things in manufacturing that we talk about. But one is, those of you who don't, we call it continuous manufacturing, right? Many of you drink Pepsi or Coke or paint, all of those things. They are continuously made. That means you don't put, you know, it's a chemical reaction that happens somewhere, right? So you just continuously make them. There's a lot of science behind it. Then there is what we call discrete manufacturing. So you guys, how many of you have driven a car yet? Not old enough to drive a car? Yeah, there you go. And how many of you have gone in a plane? Those are all discrete parts, right? You bring hundreds of parts together. Somebody says how it all comes together, right? So in one case, somebody says how the chemistry happens, in whether it's salt or Pepsi. When you go into a car, somebody says how do all these pieces come together to make a car, right? That's what we call discrete manufacturing. The third one is actually very interesting. It's the oldest. It's been there forever. It's called what I call organic manufacturing, right? There, how many of you have eaten an apple, right? Or how many of you have, now look at, you have brothers, sisters, we all come out of, right? What happens? Right in that one piece of DNA that, you know, Dr. Vakanti was talking about, the entire code for how that apple is going to be is in there. In fact, the seed for that apple tree has the whole thing. So you put the seed actually pulls information, pulls stuff from the ground and becomes a tree, right? And then it creates the next seed. In technical terms, you know, we call this cybernetic systems, right? That's not something for you guys to look up. But these are systems that are able to not only do things, but create themselves, the next generation, right? They are really interesting. So what you see is the evolution and the re-evolution of what we call organic manufacturing. That's what's going on here, which Dr. Vakanti is talking about. The trick is, it happens in nature. Now the question is, how do we engineer it, right? And I think what Dr. Vakanti is telling you is, you guys in your generation are going to not only engineer this, but you're going to get the benefits of it, right? So we were talking about it, you know, 1918 something, Carl Benz built the first car. That created a $1 trillion industry, right? The Wright brothers, Dr. Vacanti was talking about 1903, they came up with the science. Today we have the science. So as you guys look at it, kids look at it, think about you are going to be actually engineer these things. You have the future in front of you. Now going back to Dr. Pearl's question, I'll kind of say a couple of things. So if you look at the evolution of any industry, you start basically by first saying the science. Do we know the science? Yes, you know the science, but if you have 10 people using it, it's great. But if I have to have it given to 1 billion people, that's a problem. Then how do we basically create the scalability? So you end up creating different jobs, right? So for example, if you look at this over time, there'll be new people who will come in. Some people will only do the science of how this happens. Others will say, how do I turn it into a production? Then somebody will say, well, you have to make sure that the government has legal compliance, all of that stuff that comes around these things. But then somebody else has to buy it, right? So to be able to make it, but somebody has to buy it. So you have to have people not only to make it and scale, but what we call distribute it in this case. So the how do you deliver it into a person? So as you evolve this through these things, what you find is what we in business call value chains are created, right? There are all these different players which will become the kinds of things that you can look at and think about what it'll do in terms of jobs, in terms of opportunities to innovate, right? So I'll start with that, Dr. Paul.
No, I got a question though for Joe. So Mr. Guha has just created this sales force and marketing and everything else. When we had living-related and cadaver organs, we didn't market them, we didn't sell them, we didn't have a sales force. What's the ethics of all that?
What did you say, cadaver?
Yeah.
Okay, super. That's a rather precise question.
Yes. No, we didn't. I mean, I'm saying in the current method in which we do transplantation, there's no marketing, there's no sales, there's nothing, and Guha just created an entire industry. What's the ethics of that?
Super. Well, a word about ethics first. And Dr. Pearl, who is a Peoria legend, constructed our panel in the sense of collaboration. Because really, in the development of the new, we're all in this together. And I believe that a certain form of collaboration and collegiality, and we see that in all the professions, is really a sign of peace. Because in our society, don't we see persons who almost want to tear apart and separate us into different groups, isolated from each other? Collegiality is a way of understanding different perspectives, opinions, visions, and then in that respect, that is the work of peace. And that's really what ethics is about. The word ethics can sound kind of scary, right? Because in my world of healthcare, when someone says, we have an ethics, the next word is problem. And it's usually a question, a challenge. Nobody looks on the happy side of ethics. People look at me in a glum way. You pat me on the back and say, hang in there, Joe. But what's the underlying thing about ethics? I would say in our professions, it is doing the good. Keeping the promises that we have in science and medicine in a sort of social compact with persons, with our society, promising the good. That's what I heard in Dr. Vacanti's presentation and also in his first response. He was motivated by helping humanity. And I think that's fundamental to an ethics analysis. Ethics comes from the old Greek word ethos, that means custom or conduct, trying to focus on human awareness, attitudes, and actions that are consistent with the good. You heard him say he was troubled by persons who would die without effective intervention. And over the course of his training, in a speech earlier today, Dr. Vacanti said that he grew up in a medical world in which this vision was simply unimaginable. And he embarked in the imagination. But the motivation, and that's where ethics comes in, is a vision of helping humanity. I sometimes say to my colleagues in the professions, it's good that we say on occasion that we want to help persons. We want to help humanity. Because I think that's good for us, because we can be overwhelmed with the tasks at hand. It's edifying to our colleagues, and it helps sustain our inner cultures. And then within that vision of doing good and helping humanity, specific questions would arise. And now I'm finally answering your question, because we have a vision of commercializing and ramping up for a vision of greater numbers, a value chain, whereas the old model was one organ becomes available at a time. When we had that, and that's the world that we inherited, wasn't it, Dr. Vacanti? That there were several sources for organs, one with persons who were brain dead, other persons who were in a dying process. And for that, the first thing we needed was consent, permission of the survivors. For many of us, we can also create something like an advance directive that, we wish our organs to be donated for the good of humanity. And within that world of organ transplantation, we have one team of physicians that are caring for the dying person and another team that is prepared to do the transplantation, because we don't want to blur roles. That's part of the proactive ethics. We want to make sure we do the good thing in a good way. When we shift to a vision of ramping up for more tissue that's developed through almost an industrial model, we move into a new framework where it's not relying on the one organ at a time. And that means that we wouldn't have a range of the earlier problems that we grew up with. Is that responsive to you?
In a way, yeah.
In a way, good. That's what I hope for as an ethicist, in a way.
Throw the humor in. Nobody's laughing. Okay. I guess it's very limited. All right, what are the spin-off industries and businesses that will be created from the production and utilization of tissue-engineered organs? This may be a bit of a stretch, this question. So it goes back to what Mr. Guha was talking about. So you have the folks that will have to make these organs. Then he talked about having basically a chain of events after that. You're going to have marketing. You want to expand on what you were talking about when you talked about that?
Sure, I'll try to, and maybe I'll go back to the car industry, right? Those of you who know that cars, have any of you heard of the company called Ford Motor Company, right? And you know Henry Ford. So somebody designed the car, but Ford actually did something very interesting. He basically said, everybody in the country needs to have a car, literally. That was his idea, right? It's just like Dr. Vikanti saying, there are 1 billion people who might have new tissue organs tomorrow, right? Why? All of these people have a reason why. And by the way, what this could mean to many of you is I'm saying it, many of you may live to be 150 years, right? Because a lot of things that you may not, now I said this, Dr. Vakanti did, so don't, but he said, I want to make cars easier to make, so it gets cheaper. I can make more cars so that everybody basically can have a car on the road. So he started creating ways to basically make, when they first started making cars, they used to make one car at a time, right? You had 20 people who are experts. They would literally go make every part in the car, put it together, and then they made one car, right? He said, this is not going to work. I can't make 100 cars a day. So he basically started having people make little pieces, send it to him, he will assemble it into a car, right? In the process of doing that, he created what was called the first manufacturing line, right? Now, as Dr. Kesh was saying, you can't do that with a person because you have a different, I have a different heart from you and everything is different. So we have now got to define how this is going to happen and everything is so different, right? How do you get the stem cells from that person, create the environment where that person's cells becomes their heart or their liver or whatever it is? So that is the one process in the manufacturing production side. But then, let's say if I'm not well tomorrow, I have to go to a place where somebody is going to be able to say, hey, this guy needs a new, whatever, right? A new kidney. Now that person has to know what to do next so that that can be transferred to somebody who can make that for you, right? Now all of this is going to work only if somebody is paying for everything that costs along the way, right? So that is the evolution process that you guys will see. And this is, mind you, I want to be very specific about this. This is not boring stuff. Things like this don't happen just like that. Enormous amount of innovation, it goes on to turn the science into something that can hit and help billions of people. It takes a lot of thinking, a lot of innovation to help that happen, right? So when great science comes, like somebody comes up with a plane, somebody has to turn it into a Boeing aircraft company, right? That can make make a lot of planes. So that is the opportunity, that is the future, right?
Jay, did you know you're going to be a Boeing aircraft company? I didn't know that.
Can I make a comment?
Yeah, please.
So, thank you. That's a very important perspective. But here's where imagination comes in. So let's say we can make all of these things standardized, boom, 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 just like the Model A Ford, except the cells. So there are two approaches. One is, Jesus, we got to go from one individual to the next to the next. Or the other one would be, why don't we just make a cell that anybody can use? So instead of deciding that you're going to build a whole infrastructure on that piece that requires each person to donate their own cells and give them back, let's concentrate on figuring out what the important signals are to make a stem cell that will be universally accepted by either a lot of people or all of the people, so that then you focus the creative energy on finding the best solution for the ultimate goal. And that's where people's imagination comes in. That's where the creativity comes in. And that's where all the teams that you need to actually pull such a thing off. And I'll use a particular example. There was about a decade where we would say in our science papers, well, we're using these cells. We have to, if we want a piece of bone, we have to start with bone cells. They're going to have to come from the patient. We have to grow the bone cells, and it's really an incredible pain to grow bone cells. But that's what we got to do. And we started saying, God, wouldn't it be great if there was a cell that you could just make grow, proliferate, to make 1 billion cells, and then tell that cell to turn into a bone cell? That would help us so much. We didn't have a name for it, but other people discovered such a cell, and it's now called a stem cell. So it was imagination that eventually led to a very important scientific discovery, which then we can now take back and use to our advantage. So to carry that just one step further, if you give me one more step, there is a place at the University of Wisconsin that has figured out, because they've done a lot of the pioneering stem cell research, but they also figured out, at least in this country, for the immune system, which looks incredibly complex and almost individualized, they figured out that the population in this country roughly sorts out into 18 buckets of different immune systems. So you can start to think about it as, again, manufacturing, but instead of just one bucket, currently it looks like we'd need 18. So if I was going to give you a new heart, we'd have to study your biology and figure out which one of those 18 buckets your cells are going to come from. But once we know, then we order up, from bucket A12C that that's you. We grow up those cells from a big vat, and then we send it to you, and your immune system thinks it's you. So it's a step along the way, but it's all because of people's creative imagination with an end goal in mind.
Quick question for you, Jay. Will living-related and cadaver transplants still be necessary, and if so, why?
So the answer is, through my rose-colored glasses, no. It's all going to disappear. It's going to look medieval someday. But in the meantime, the system has to evolve. There can be step function improvements in the science and technology, but then the path to universal replacement takes longer. There were a lot of people still manufacturing buggy whips well after cars were being produced. And they said, these cars, this is not going to last. You need a damn good horse and a buggy, and I'm going to keep making buggy whips. At the end of the day, not so much. So I think the trajectory is longer for adoption than it is for science.
What if everybody saved cord blood and froze it? Would that advance the science of this? And then if they needed a transplanted organ, defrost their cord blood and use it for stem cells?
Yeah, that could be a road, but it could be a blind end. So nobody really knows the answer to that, but there are a lot of people that are making money on freezing cord blood because it's sort of like an insurance policy. So if you're going to be a new mother or a new father, one of the first questions you're asked is, do you want to freeze away some cord blood? And of course you do, but then it comes with, like subscribing for Verizon. There's a monthly fee that goes on forever. So you have to make a decision. Would this actually help my baby in 10 or 20 years? Or is it a dead end that cost me $10,000? And it's an interesting ethical decision because it's coercive.
Yes.
And I would like to ask a follow-up question. From the tissue engineering 3D perspective, which organ in the human body is the most complicated to print?
So I'll answer it backwards. The answer is they're all incredibly complicated. But given that they're all incredibly complicated, to us, from an engineering standpoint, the liver is the simplest. And the reason I believe it's the simplest is pure logic. And the principle that we've learned is the more closely our engineered organ needs to look exactly like the organ, the more difficult it is. So if you're a lung, there has to be no space between the capillary blood vessel and the air cell side. No space, meaning no tissue in between. That's really, really hard to duplicate. So that's not on our top list. The liver, on the other hand, is all about numbers of cells. So in all of our livers, it's roughly the size of an American football. And that's a huge amount of cells. If you do the math, it's a massive amount of cells. But the 500 functions that a liver does is mostly contained in each individual cell. So if you consider the cell a brick, it's mostly getting enough bricks in so that you can actually help a patient. So then the architecture, which is fairly complex, but comparing it to a lung, it's sort of a walk in the park. So we've chosen liver for that and other reasons.
Let me just ask you one more follow-up question. So if you think of parts which are not made like the living products, like having an artificial heart made out of real mechanical pumps and things like that, do you think there's a balance between, or is a need for tissue engineering if you can produce mechanically made parts with nano systems that could do something as good as human body parts?
So did everybody understand that question? Okay, so I'll give you a exact example of that. If you guys go to the display on one of the, I think it's Dr. Brewer's display on blood vessels for heart surgery in children. Well, there's a spot on it from Yale, from Dr. Mark Saltzman, who runs all of their bioengineering at Yale University. Well, he's this gray-haired, long-haired professor at Yale. Well, he started at MIT as this kid like you guys with red hair, big, thick glasses and red hair. So he came to the laboratory very early on. He was our very first student. And we were struggling, actually, with your exact question. And it's, if we're going to go down this road, is this really the best thing to do? So as his thesis for undergraduate engineering, we posed the question, one way to solve the problem for liver replacement is to build a really good machine, like a dialysis machine, and help a lot of people as a temporary bridge to transplantation.
Define the dialysis machine for them.
So dialysis is what's currently used for people that have kidney failure. So their kidneys don't work, they can't make urine. It's really a bad problem. And in the 1940s, a machine was invented that could do two of the important functions of a kidney, and it keeps people alive until they have a transplant. No such machine exists for liver. So we said, well, what if we built that versus tissue engineering, essentially an organ replacement? So Mark, this gray-haired professor, young kid, red hair, thick glasses, spent a year answering that question. And his answer as a student, senior student, was, good Lord, they're both really, really hard. Basically, he could not reach a conclusion that it was almost impossible. So I said, well, hell, if they're both almost impossible, let's go for the ultimate goal. Why fool around with making a machine if it's going to be almost as hard as making an organ? So based on his work, a lot, really, the logic and the precision in which he analyzed all the issues, that's where we are today. But when you see the display, it's humorous to me because I keep seeing you, who's now a gray-haired professor with thick glasses, some 37 years
How many of you had a
later.
chance to see the video display in the museum? Did you go in and see it? We have about a 15-minute video. On it, you'll see about 5 different organs that have been sort of partially or completely made, and you'll see exactly what Dr. Vicanti's talking about. And it's worth seeing the video before you go back to where you came from, wherever it was. Okay, next question. Who will manufacture these organs? And so the question really relates to, like, will the manufacturers be separate facilities, or doctors, hospitals, universities, corporations? What's the manufacturing? Where's this going to happen? Right now, it's in a research lab. Like Dr. Candy has a research lab, or you'll see in the videos. Each doctor is doing research, and they're personally making these organs. But that's not scalable. So who's going to be doing this? You see the question, everybody. Let's start with Kesh. Who's going to do this?
So if you think of any product that goes out into the market, it has to go from the lab and translate into the process to an organization who can do that as a business. Hospitals and universities can do the wonderful job of showing that it works, can do the scientific work, go through the human test validation, and then business has to step in. Which means that at the end of the day, if this has to be a success, you're going to see a company like Ford or like the future Amazons coming and doing this. I'm not saying that you will go online and buy it and be delivered next door to your home and someone will steal it, but you will find companies doing that. So I think in 20-25 years, I know that Dr. Vicanti himself is a founder of a couple of companies which is going through this process, I'm not sure whether your vision is to be mass producing it or making a technology and have someone else mass produce it. But I definitely see that there's going to be companies like, Caterpillars of the world who will be making this, and there'll be competition, and the best company will survive.
Organs are us. Is that where?
So I think you have to get that name website right away before someone takes it.
Jay, are you going to be in the organ business?
I think you should comment on this rather than me. By the time things reach that stage, I'll be way too old. And I don't know a damn thing about business. So, but I agree that at some point you have to transition from the university setting to commercialization. And everything we do as doctors, especially surgeons, if you walk into the hospital or even the simulation center, every single thing we do and use on patients has gone through the industrialization process. Even simple things, bandages, IV tubing, obviously all the medications, all the equipment, everything has been commercialized. And this will be also. But exactly how and who, but somebody's going to be the next Google guy for regenerative medicine.
Yeah.
Somebody's going to be the next Amazon guy for this field.
Go ahead.
I think almost everything has been, but how many of you have had a course on economics? Any of you? Have you touched economics? Do you know what economics is? Okay. So if science is one bookend in life, and whatever you guys do, economics is the other bookend, right? Everything happens between two. And there's just one third thing we'll come back to the end of it. That between these three things, I think there's almost, so economics is about how, science can come up with a great idea, but economics says, how do you turn it into something that is valuable, scalable, and right? And in economics, there are two factors of economics, right? When you take your first book on economics, that's about all you really need to know about economics. It says two things. You need to know about labor and capital, right? Those are the two fundamental factors of economics. So if you go into any business, you have to figure out how are you going to deploy capital and labor to make something that produces something that somebody will buy, right? That's the foundation principle. So what they're talking about is how is this economic chain, this all going to come together, right? Everybody from the person who maybe you call and says, I need a lever, to the person who says, what is that going to look like, and who's going to make it, and how they're going to ship it. Is it going to come on Federal Express, FedEx, or is it going to show up, in a private jet? How is that going to work? All the way to who's going to get it into. So that is the whole process. But the fundamental thing is, everybody along the way, there are two things you need to think about. It's not important that you can do this once. How do you do it 1 billion times a year? Right? That's a question. And every one of these things has to happen in 1 billion times a year. Everybody who touches it has to somehow make money doing it. Right? Everybody wants to do the right thing, do good things in life. But we all need money to basically make it interesting. Right? So how does everybody who touch it make money? And if you make it, it's great if everybody can make money. If it costs me $1 million to get a new kidney, right, there are probably only 10 people who can afford it. So you got to bring the price down of this whole chain of events to the point where somebody can afford it, right, reasonably with their income. So that basically shapes what we call the cost curve, right, the economics of it, until the point where everybody who touches it makes money. It actually is great science being delivered to the person who needs it, right? Wherever he is in the world. So this is basically, think of how this whole thing happened in the automotive industry. Today, the automotive industry is a $1 trillion industry. In other words, they basically effectively do about $1 trillion of money to basically make sure everybody gets parts, they get, spare parts, they get service, everything else, right? It's actually a pretty substantial portion of the US economy. And if you add the roads, transportation that it created, so it created a massive wave. So what we are talking about is the opportunity, but the reason why economics and science exist, and I want to close on that idea just for a minute, is ultimately to serve people. Why does the car industry do well? Why does the automotive industry do well? All of economics and science is designed to help people, right? That's what drives the scale, the performance, and that's the continuity in ethics Joseph was talking about. So as you guys think about it, those are the three things I want you to kind of think about. You get an opportunity as new science comes out to create the future. You get the chance to serve people all over the world and actually create extraordinary industry, which will ultimately help you every step of the way. So,
Briefly, Joe, how do you feel about an industry that now is going to have a profit motive, where you're going to be figuring out how much to charge and how much profit you can make to buy an organ? I mean, that's a real issue now, what we're talking about.
No, I think it's a fantastic vision of the future, because we reference serving humanity, so there will be questions of what type of access that will be present in it, because it wouldn't be an add-on like a Fitbit or something you put on your wrist. It's something that goes in you, that sustains your very being. So what I would hope would be the industry of the future that shapes this would be what we see in the business literature now of enlightened companies. You know, a company that has a vision about the inner culture of the workforce, as well as the product they make and the way it's presented to humanity. And I think we need an evolving idea of that, because when we had the discussion of the early industrial revolution, there was the great draw of persons from the agricultural life to now the urban centers, but the industrial life was often very harsh, and it had to be humanized over time, so that there would be the right environment for workers to flourish as persons. So I think part of the new vision is also what sort of company should sustain this in the future. And if I can make a shameless plug for Peoria, is that I'm on the faculty of the College of Medicine, taught ethics, and I taught ethics in nursing. We have 5 nursing programs in the city. And I think this is a very rich area for the healthcare sciences. And my final comment would be really an appreciation of Dr. Vacanti's presence with us today, because your children or you or the persons you serve if you go into healthcare will be benefited from the trailblazing work of Dr. Vacanti. And so to have almost this moment of pause and a breath and to say, I heard one of the pioneers of this breakthrough area in healthcare sciences. And I heard it in Peoria, Illinois in my high school years. And this orients me to the future. And that shows, I think, a flow of goodness and humanity and compassion in our world.
Here's the most pragmatic question. How will you determine how much to charge for these organs? You know, well, I got a good liver on the shelf here today. I think this liver is worth perhaps, geez, what do you think, Jay? How are we going to figure out how much to charge for these organs?
Well, actually, I've thought about that, but I've thought about it in principle without the expertise of the panel that's here. But there's a fundamental principle in business that people don't like to admit, and the principle is whatever the market will bear. And so there is an implicit coercion that you will pay. Say it's your baby again. Now let's say you can buy an organ. There's an implicit coercion that you will do or pay anything to help your baby. So if you were a pure businessman, even if you weren't unscrupulous, but you were a business, it's whatever the market will bear. And so if you can extract $1 million for that organ, you will. And that wouldn't be wrong, but it would be wrong. And so to basically answer Rick's question, there need to be people that are sensitive to the issue, that are put into the equation of pure business. And I don't know how that's done in this country. It's done in more than one way, but oftentimes you see government intervention. And so something that modulates the pure business motive is government. And when business can't do it itself, then government will write a law or make a regulation, and it modulates the pure motive of money. And so in some way or another, that needs to be part of the equation. How do you make it reasonable? And that's what this country is struggling about with the pharmaceutical industry. Because there have been so many examples over the last 5 years where it's just unscrupulous rape, period. And it's not right. So how do you modulate that and make it reasonable for people that need these medications? And I think the same is going to be true with this struggle. And I don't know the outcome, but I think it somehow has to be tied to cost.
Yeah, well, clearly the government hasn't modulated the drug companies yet. So
Exactly right. And so it needs to be determined, but I think it needs to be limited to cost. And if you're fantasizing what this looks like, the scaffolding is cheap. It is dirt cheap. It is pennies cheap. So you can make a liver, a lung, or a kidney once you have the design using these materials in three-dimensional printers that are really cheap.
Yeah,
Not, they're hundreds of dollars.
Yeah,
not
Jay,
thousands.
wouldn't you have to factor in the years of experiments that got you there?
Yeah, that's what the drug companies say. But you know what? That's already been spent.
It's sunk cost?
It's already been spent.
Yeah.
So you've got the expense of the scaffold, which is cheap, and the more you scale the living component, the cheaper it gets.
Yeah.
So whether it's vaccines or all the biologics that are used today, it goes down very, very much. So it makes, conceptually, it makes this much, much, much cheaper than the way we do transplants today. So really, how do you take that and convert it into a business model that's attractive, but not excessively profiteering?
Yes, and if I could, along the way, we're moving from the era of scarcity, of relying on a discrete available organ, to now an industrial model. And in the old scarcity model, you saw many patients die without it. We have prohibited, because of the ethics of it, paying persons for organ donations. Why? Because poor persons who are living in a world of pressing demands on them could be coerced into limiting their own health for the sake of an immediate need for their family. We also have seen abuses around the world. There are documentations that in China, in prisons, people could order organs for transplantation, and prisoners would be executed in a way so that the organs would not be harmed. So we're moving from that world of scarcity to new and industrial model. So looking for that enlightened company with a humanitarian instinct.
This also, the model is going to change, right? Right now, everyone has an equal chance of getting a transplant if you're in a registry and you're waiting for it. Now this will switch to a insurance model, right? And which means that if you have an insurance and the insurance pay for it, you can get a new liver. If you don't, even though the technology exists, you'll never get it. So I think it's going to create the whole world, which is going to be very different.
Well, I had a lot more questions prepared, but the witching hour has arrived. It's 12. We're going to end with our woe dude slide. I would like to thank Dr. Folkman for traveling to Peoria. I would like to thank our panel for their excellent comments. And I'd like to just tell you folks that it all starts when it's your age, and with whatever your aha moment may be. And I didn't know I was going to be a pediatric surgeon when I was your age, but I ended up being one. I didn't even go to medical school until I was 32. So, there's lots of things you can do with your lives, but don't be a couch potato, figure out something fascinating and aim high, you know. If you don't aim high, you'll sure end up being low. Thanks for coming here today.
And on the behalf of the Peoria Riverfront Museum, I just wanted to extend our thank you to all of you, our wonderful panelists who have spoken today. I enjoyed it very much, and I hope that the students here did as well and found some enlightening information shared today. Students, thank you for coming. There's lunch been provided for you by Jump very generously. That will be downstairs in the auditorium, so you are welcome to head down that way.